Hi again. Often problems are much simpler and direct than the original diagnosis would indicate. So here's an example. Recently, a woman in her 50s came into my office on crutches. 5 months earlier, her knees had begun hurting and just got worse and worse. And she was told that she had bone marrow and subchondral edema and inflamed cartilage. A pretty dramatic diagnosis. So in the following months, she had had 10 sessions of plasma infiltration plus oxygen therapy and physical therapy, none of which really had helped. My approach is always to note the diagnosis, but also to be open to the possibility, or better, the probability, that this type of problem may actually be much simpler. In my experience, this sort of pain often originates in the muscles and in the connective tissues. When they are tense and tight, they can be extremely painful and then cause a chain reaction of other issues. In the first session, it's important to try to ascertain the cause of the pain. Why is this happening? Tight hip and leg muscles are often a factor. In this case, I first focused on the gluteus medius, the hip muscle often associated with knee pain. So pressure on certain trigger points recreated the pain in her knee. Recreating the pain is normally the best test for discovering its origin. By releasing that muscle and one in her thigh and behind her knee, her pain completely disappeared and she no longer needed those crutches. Well, to make sure all is well and that the problem is completely eliminated, I ask the person to go the limit and try to recreate the pain. To really put those knees to the test, she did a couple of free squats. See, by doing that, she did feel a bit of pain down the front of the knee. That we could eliminate in another session. Two important tenets of MyoLabTherapy are, first, remembering that the simpler explanation for a problem is often the most accurate. And second, to always try the least invasive intervention first. It is often the fastest and the most effective therapy anyway. So if previous attempts at relieving your pain have not given you the relief you want, maybe it's time to try a new therapy. And thanks again for watching.